I'm Amy, sex educator, sex and relationship coach, and sex shop owner.
And I'm April, VP of an international high-end pleasure products company and boss queen sex toy mogul. We're best friends who make our own rules about who we are as sexual beings.
With everything from how to be a badass in the bedroom to top tips for bringing your relationship to the next level, we have something just for you.
So sit back, relax, and enjoy the show.
Don't forget to head on over to our website at shamelesssex.com for more. And for 15% off of some of our favorite sex toys, use coupon code SHAMELESSPP in all caps at purepleasureshop.com.
You are listening to a pleasure podcast. For more from our sex podcast collective, visit pleasurepodcasts.com.
Well, hello, everyone.
Hey, everybody.
Welcome to the Shameless Sex Podcast. This episode is much needed. April and I were talking today how we haven't had a full episode on STIs, STDs.
I prefer STIDs and STIs.
Yeah. STIs. STIs. Sexually transmitted diseases, infections. And if you're already like, shit, I'm going to tune out. That sounds boring. There's really important information for you if you are a sexually active person, if you are someone that has children, if you are potentially going to be sexually active again with someone new, if you are sexually active with a current partner and you haven't been tested in a long time. There's a lot of reasons why this may apply to you. So stay tuned. It's not the one that's like, ooh, yeah, the juiciest and sexiest, but it's much needed information. And we have a doctor here. Dr. Remy Paille.
Nurse practitioner.
Nurse practitioner.
I want to call you doc. You're my doctor, though.
STIs.
I'm your primary care provider.
Oh, there you go.
Oh, yeah.
A PCP.
I still want to call you doctor.
I feel like STIDs and STIs, they affect everyone in some way. I mean, we have to think of that at least as something that, right? This is important for everyone. I don't know. I feel like if you or someone you know would be affected by this, if you're having sex.
We're living in the modern day and age. Granted, if you maybe lost losing your virginity. The first time that you had sex with someone was their first time that they had sex, and then you are still together 50 years later, and no one had any affairs or cheating or saw a sex worker or
toilet seat mishap,
rub their genitals all
Does that
over.
happen, Remy?
It would be like 1 in a zillion, so it
okay.
doesn't really happen.
Pretty
There's
rare.
no reported
So you're
cases
saying there's a
of
chance.
that. And a lot of times people are just really afraid of STIs, so they don't want to talk about them.
Yeah.
So
That's true.
they'd rather not. And it's
scary.
good to talk about them. It's
Yeah.
good to talk about them with all your loved ones.
Yeah, I think that conversations around STIs, STDs with new lovers, you can make it sexy, and we can talk a little more about how to have these conversations because we have a sex question about that. But Remy, maybe you can start with, because you are a nurse practitioner, and I like to call you doctor. Tell our listeners more about who you are, what you do, the kind of work you do with patients. Give them a little 411. And then also, what is a nurse practitioner? A lot of people probably I don't know what that means.
Yeah, so I always wanted to do primary care. Actually, my first career was as a body worker. So I did body work for about 13 years.
So you know the body, but
Not
actually
sexological body work.
No.
As a nurse practitioner, I work really closely with all my physician colleagues, asking them questions when I see something I haven't seen before. I have one physician that reads all my notes and signs off on them, will send me questions. She'll maybe say, order this test. And so I get a little bit of extra mentorship on my way, but it's very much autonomous and at the same time collaborative because we all work together. So,
And you said even today you saw some like patients that were 14 and then 86, which I thought was so
variety.
Yeah.
interesting.
And we were commenting on some of our experiences with nurse practitioners was actually better or more ideal. And I've had some other nurse friends that say that if you can, depending on the thing that you're going for, the nurse practitioner seems to be able to give you a little more attention. They have a little more time. Maybe there's some things that you can't always address, but you have these other folks that you can always see or ask questions to. So
My experience has been much, I feel, more tended to, cared for, and almost that the nurse practitioners have cared more. It's not as clinical feeling. And I mean, for Western medicine, sometimes you feel like you're just a number and you roll in and there's a clipboard and it's like you're checking boxes. And I'm like, what are you checking? Like, what are you? And the nurse practitioner talks to you and kind of asks you about your experiences. And I've had really, really great experiences with nurse practitioners. And the training is just as intensive. So
it's intensive training. The training is different in that I came to become a nurse practitioner out of 7 years of working as a nurse, which is a very different role where you're still following physician's orders. And then you go to a 2-year training program, and then you do about 1,000 hours of clinical training versus a physician goes to 4 years of medical school, and then they have a minimum of 3-year residency. So there is more training involved with a physician. And so that being said, I can approach it with a more holistic mindset. The whole nursing process is different than the medical mindset, which is a lot more clinical and didactic. And so the combination is kind of what you want when you're trying to get some complex health issues.
I love anything holistic. Holistic for folks who don't know what holistic means. I mean, there's probably a lot of definitions for it, but it's like an entire integration of all aspects of you and your body, your spirit, your mental health, including everything there, and not just breaking you down into little parts.
Not just being like, here, pop this pill. This is going to be your solution.
This is a pill for
it's
your
like,
pussy.
Wait, let's assess all the angles. What are you eating for breakfast? Are you getting a lot of anal penetration? Or is that one? I don't know if that's the one.
I ask about it from time to time if people have anal complaints. But I really do stress the basics of health, which is, are you sleeping enough?
Yeah.
Are you eating? Yeah. Are you getting exercise? Do you have somebody to hug? Do you have friends you can call? What's a perfect day look like for you? So all of those things getting in order, I could prescribe all the pills in the world, all the supplements in the world. And if people aren't getting their really basic, if they're not sleeping and they don't realize how important that is, then nothing I do is going to make them healthy.
I think, to get this podcast really just supercharged, I want to share I've never shared this on the podcast before. And I will, because I feel like it's exciting. When I was 17, I was diagnosed with a lifelong STD. And when I was in the room with the doctor, I had only had one partner, penis and vagina partner. So I had
the face. Not just for this story. There's other reasons why.
But
I don't even know him, but I'm like, I want to touch him.
I did have partners before with like oral and stuff. But when I had the meeting with the doctor, I was having all these issues, and I went in, and my mom was in the waiting room waiting for me. I was 17, so I was 16. I think I was almost 17. I can't remember, but it was one of the most horrible experiences of my life. And he came back in, and the doctor said, after running his test, he said basically that my life was over.
No way. He actually said that.
Yeah. And that in those words, he's like, I don't know who your boyfriend is. And he uses quotation marks, the air quotes. And he said, I don't know who your boyfriend is, but, he's been lying to you, and he obviously isn't just with you, and your life is over. And I literally was like, what are you talking about? And then he gave me my diagnosis. I lost my shit. I'd been there for almost 3 hours. My mom was trying to get into the actual room. They wouldn't give her any information. She thought I was like dying. She didn't know what was happening, because I went in with a problem and I came out with a bigger problem in everyone's eyes. So it was this horrible experience. And I've had a lot of shame around that my entire, sexually, mature age. So whatever, if you consider me like sexually mature at that age, I was having sex. So it really was difficult for me moving forward in my life to actually, be open about that. I had a lot of shame. And because my life was over.
Wisconsin?
Yeah, in Wisconsin, circa 1998, I think, or 1999. And it was a really, really hard experience. And then slowly now, moving, forward into my mid 30s, I'm very comfortable with who I am and the experiences that I've had and how to mitigate my sexually transmitted disease that I've had since I was 17. And that experience was horrible. And I hope that this podcast can shed some light and help folks out there, because it's a very real thing. Mm-hmm. And STDs, I had slept with no one except one person. And that the way the doctor handled it was shitty. And I hope that we can just help people with this information and everything else just feel okay about some things.
It's
And
not a death sentence. You're not broken. Your life is not over.
Exactly. My life was not over. I did think it was for a minute, but I survived, and we're here to help you survive all your things too. And Dr. Remy or Remy is here.
I am so sorry that happened to you.
Yeah, it was heavy.
And I was just right there with you when you're talking about that. And then I was also right there with you when you talk about how you've turned it around and you've used it to right now help people get through that, because there are so many people in that same box, who will say, oh yeah, it's fine if I get chlamydia, gonorrhea, but God, if I got herpes, my life would be over. And I have to say, no, I know couples, one of them might have herpes and the other one has not gotten it for 15 years and they're just fine. And there's ways to control everything. And once again, we come back to the basics of taking really good care of yourself, and that it's not a death sentence. It's not about shame and blame, but we need to turn that around.
Yeah, it's not the end of the world. So it sounds like the doctor had their own lack of education around the topic, their own shaming, their own opinions about it. That still is to this day I'm sure is happening.
Well, going to he was a general practitioner as a 17-year-old cis woman. It was really hard for me as it was, because I'd never seen a gyno before. And so it was already this extra traumatic experience.
You've seen a man to look at your vagina.
Spread your legs.
Get into anybody else. And I had this issue. So he was the only one I could get into ASAP. And that's why it was, and my mom wasn't in the room, which is even more bizarre. I was actually alone with him in the room.
You should have had a female chaperone.
Right?
Yeah.
Isn't that interesting?
Things that have happened that we go back.
Recently to go have my sis look at there was a
female chaperone. Yeah. Just to make everybody feel comfortable. Yeah.
And I know I didn't even comment, but I was like, oh, I don't feel like I've experienced it before, because I have been to other cis male gynecologists before, and there hasn't been a woman, but this time there was, and I was like, I like this.
It just feels comfortable. Yeah. It makes the male docs feel more comfortable too, where they say,
especially right now.
I've got a little extra set of hands right now, and and the things that have been done to women in the past, no
chance of that happening.
Speak up.
No chance.
Well, should we? Yeah.
What's the difference? So let's talk about what's the difference between STI and STD.
All right.
Because
so
right now we're using STI more commonly.
Yeah, and that's mostly because it's not necessarily a disease, because we're just trying to remove the stigmatization of a disease. You're not diseased. You have an infection, and we'll treat an infection. So we look at that. Yeah. And so it's mostly just making it a better word to say, yes, I have an infection, and you treat an infection. People have diseases, and so it's just the nomenclature.
And so an STI, infection, STD, disease. So, I mean, talking about like chlamydia and gonorrhea. Okay, and this is one thing I just want to clarify. A lot of people think the clap is chlamydia, but it's actually gonorrhea. And both of them are curable. So that would be an infection with, I think chlamydia is just, you can take one pill, isn't it?
Yeah, it's 2 pills.
Two
What's
pills,
1,000 grams
I mean, I've
of
had chlamydia
azithromycin.
before.
I always thought, and I called it the clap when you got it. I was like, you got the clap.
I'm like, no.
Remember that song from Get Him to the Greek where he's like, I got the clap.
Yeah, I got the clap. And I got the clap, honestly, from like just the tip experience where like it was just like essentially naked dry humping without anything going inside, but just the tip, and there's a lot of body fluids, and that is how easy it is to get chlamydia. Was that all it took was like a little bit of fluid to touch a little bit of fluid, and there was chlamydia. And I've heard this from other friends that have had chlamydia too. So I don't know. I mean,
these little bugs, they're just crawling all around us. We can't see them, and there's little bugs.
Herpes,
there's good bugs, bad bugs.
And herpes is just skin to skin, right?
Yeah. And you never know when you're shedding or not. And so it's hard to counsel people on it because theoretically the likelihood of passing it on to a partner when somebody hasn't had an outbreak in a really long time, when they're healthy, they're not immunocompromised, it's really pretty low, but I can't tell you how low.
Yeah.
Nobody really can. So.
I think, one way to know, so I have had partners who, and like newer partners who have said that they have disclosed their STI status, and they actually open the conversation like, "Hey, our bodies are starting to get close. We're not having penetrative sex yet, but it looks like that's going to happen. Let's have a conversation." I'm like, "I fucking love you.
That's easy. I love you. Now I want you even more.
I want you even more." They actually initiated that. They're also very sex positive, and they're more in that world. And they, did disclose something that they did have herpes, and but they also said, "I haven't had an outbreak for 8 years. I'm really healthy. I know how to manage it. I know how it feels in my body when I get it." I think they said all those things, or maybe I asked questions around that. And so, like, those are, I think, some of the important questions. Isn't just like, do you have a thing? When's the last time you're tested? Those are good things to ask. But, like, what does it feel like in your body when you have it? How do you take care of yourself? What's your health management like? Because if you're beating your body up all the time, you're probably more likely for this thing to come out. But there are ways to go about it where it really, and then you decrease shame for them. You're not
Absolutely.
like, "Oh, you're gross, you have this thing." It's more like, get curious about it and what is their experience with it and how do they take care of it. So,
and then you have informed consent,
Yes.
and then you can consent, when and if you want to go further with them. And then at least and you can say, "Okay, I brought this on," and say it does happen. Say there's that 1 in a million chance that, yes, then you end up sharing this. Then you say, "Okay, then this is how I'm going to treat this." Just like every time we get in a car, we could get in a car accident.
Yeah.
Oh, yeah.
Anything possible.
Yeah. And then there's also folks, especially in the gay, the penis identified folks, the gay community, with HIV and PrEP, and folks that are kind of exploring that. And I've been with my friends on Grindr or Scruff, and I'm like, "Let me see what's going on." And I'll ask them what the because there's different indicators on those apps that says like, "I'm on PrEP." And I was wondering if you know anything about that. So PrEP is it's an
pre-exposure prophylactic.
Okay, that's okay.
Yeah.
So that doesn't totally safeguard you, but it just kind of, if you're on then it decreases your chances.
Yeah, it actually is an HIV treatment drug. So it's often Truvada. And so people will take it so that it's an antiretroviral, and people will take it so that if they are exposed to HIV, and you've got couples who one of them is HIV positive but is taking but is on treatment, so their viral load is really low, their chance of even transmitting the condition is pretty low, and then the other person's on PrEP, that would be the safest way to move forward. And so that way, if you come into contact, then your body can bring your viral load down. And so those people, when they're on PrEP, we're still testing them. It all depends. Usually it's about every 6 months to a year, and then you just get tested and you just stay on top of that. And it's a great option for people whose insurance covers it, because it can be really expensive. And it does come with some risks of, I want to check out all your labs, make sure your liver's functioning good, make sure you're not anemic, make sure everything else is healthy, and then it's a great option for people.
My gay friends were a few of them, at least 3, so I can say my gay friends, like in various places, were like, "I love hooking up with guys, on PrEP. However, they're less safe." And not only are they less safe because you're still exposed to other STDs, they just think it's like a safety blanket for everything. So it's a good disclaimer to know that just if you're on PrEP, and it's like for any human, it's not just for one gender, it's for any human can really be on PrEP, but that was a takeaway for me where I was like, interesting. So even if you're on PrEP, you still should use condoms, because it doesn't make
other STIs.
There's other STIs.
True, and those people, when they come in, so when we're seeing them every 6 months, we're testing for every single STI. And so theoretically, those people, when they're coming in to get their refills, they should be coming in and getting tested. They're getting tested more often. So that's one safety right there. And hopefully the people who are diligent enough to want to get PrEP are going to want to avoid other STIs too. That's what we hope.
The way that the medication goes with HIV is, I know a number of HIV positive people, but it's like undetectable in their bodies because of they have access to this medication. And if they were to have sex with someone else, the chance of the other person getting HIV is like not impossible, but it's like, one, I don't even know. This is
if your viral load is so low, and so that's another thing is we're looking at their viral load. Then it's really
not.
That's why we're not seeing it.
Okay, y'all, time for a quick break. This podcast is made possible by some of our favorite things. Uberlube is one of them. It's a luxurious lubricant great for all kinds of sex. It's less likely to throw off your pH than most other lubes. Seriously? There are hundreds of doctors who recommend Uberlube to their patients, whether they want to make their hot sex even hotter or for folks who are experiencing dryness. Amy, I know you love Uberlube too. What do you love?
I love Uberlube because it has no flavor, no scent, and it feels absolutely amazing on my body. In fact, I want it everywhere. I even use it in my hair for my hair frizzies, for massage, and it can also prevent chafing. Oh, and the bottle is gorgeous. It's discreet and looks like a beautiful cosmetic product, so you can leave it on your nightstand shamelessly. To learn why we think it's the best lube on the planet, go check out uberlube.com. Use coupon code SHAMELESSSEX and you get 10% off and free shipping. Again, that's uberlube.com, code SHAMELESSSEX and 10% off and free shipping.
This podcast was also made possible by omgs.com. OMGS is a research-based online program that helps you add more sexy things to your menu. OMGS studied thousands of vulva owners to find out how they orgasm and then made tasteful and inspiring short videos to show you techniques on how to pleasure yourself or another vulva. Amy, tell us why you love OMGS.
I've been recommending OMGS to my clients for years, and it has changed their lives. Whether you're already having good orgasms and want to have even better orgasms, or perhaps you want to explore more variety in your playtime, or even learn how to pleasure someone else's vulva, OMGS will have something for you. With 2 seasons, one all about internal and the other all about external techniques, it's better than any book or DVD that money can buy. To learn more, visit omgs.com/shameless, and our listeners get $5 off. That's omgs.com/shameless. You get $5 off. Go check it out now. And back to the show. As someone who got a cold sore virus from making out with someone in Hawaii, if you're listening, you know who you are. You told me it was a sun blister. It was not a sun blister, motherfucker. I got really
in his
sick.
eye it was, because that's how they present.
Yes. And it's like, it's a sun blister. My bad for being 18 and making out with someone with a giant sun blister on your face, but it only took 3 days for me to get really sick and have a huge cold sore
3
on my
days.
face.
Wow.
And then white canker sores all down my throat and my mouth. I was like literally sick. It felt like swallowing glass, but I had a huge cold sore. And I went up to him and I was like, that's not a sun blister. Like, I got really sick from you. He's like, that was not from me. Anyways, and then also chlamydia. I think like 5 days I showed symptoms. So you're talking when you can test. This isn't
when we can test. Yeah. So if somebody presents with an outbreak, then I can culture it. And as soon as they get an outbreak. Yeah.
When I hooked up with this guy in Australia, he was telling me, because he had a lot of unprotected sex, he's like, well, I have a doctor. He called him Dr. Dick. I think it was something Richard. I don't know. I'm not saying names, but they call him Dr. Dick, and he would just go get a blood test. And I was thinking to myself the same thing. I was like, dude, you can't test for things right after you have sex with someone unprotected. And so I kind of was like, okay, red flag. We need a condom all the time. And he got really offended. And I was like, well, maybe this isn't going to work.
Yeah, maybe it's not going to work.
And if you're listening, you know who you are. And
I would say anyone that you're sleeping with who gets offended when you say we need to, I want to use a condom. I personally, my stance would be do not fuck that person. And if they're fighting their way out of using protection when you say that you want to use it, then that is, to me, is kind of an issue, because you're being your own authority for your body, and then they're throwing a fit over it. I get that it feels better without a condom, and I get to decide what happens with my body, and if you're not on board, then let's not fuck. Let's not have sex.
And I counsel so many young people, and something that goes hand in hand with that is intoxication. Mm-hmm. So it's so much easier to be like, okay, fine, I'm going to finally give in when you're a little bit intoxicated. And so I'm like, hey, if you really like somebody, try sober sex. It feels so good. You don't get numbed out. Try it out. Feel everything, and let that guy know everything you want and need, and respect yourself.
Yeah.
And people kind of say, wow, okay, I can do that. Yeah. And so what I also encourage my people, I just say, come on in. Come in once a month if you want to. Bring your partners in. All you have to do is pee in a cup. We'll take a look, And so it is really, really easy.
Yeah,
to do it frequently.
What about the cotton swab in the penis, like the head
The
of the
urethra?
penis? What is that for?
Yeah, so that could be one way to assess for chlamydia and gonorrhea, but really they just have to pee in a cup.
Okay.
It's easy. We'll pick it up just as easily. I usually get the results in 3 or 4 days, and if they're not sure and they think they might have picked something up, they don't know who their partner slept with, then they can come back in a month and we'll keep retesting.
I got shamed, Remy. I'm sorry, this is not about me again, but damn it, one more thing, and then I'm off of it.
Yeah.
I got shamed in Santa Cruz, actually, when I was in my single days for because I had a condom break, and so I went in to get tested. I think it was like maybe 2 weeks later, and I wasn't feeling anything, and the doctor said that I was basically being like, her words were better than this, but I was being like over cautious, and that the results probably weren't going to even be accurate, kind of thing. And that it was ridiculous that I was there again, because I'd just been tested like a month before that, but I had unprotected sex again by choice that time, but that other time was is that not
whatever helps you sleep at night?
Yeah.
And
Okay.
if it shows up and insurance covers it, because I was like something in the last statistic for Santa Cruz, a 500% increase in gonorrhea. So I see it in my college
and
students.
syphilis too. Syphilis went up a bunch.
Yeah, so the statistics are high. And so I think come in and get tested. Insurance covers it. It's practically in the water. That's how I also destigmatize it, because then I have to call people and be like, hey, I know we're just doing routine testing, but by the way, I'm sending you a prescription, And so, do it as much as you want.
Okay,
it's
good.
not going to hurt anything.
It was interesting that she did
Yeah.
kind of come down to me, and I was like, oh, maybe I am being kind of caught.
And there are a lot of judgmental providers, kind of old school, and and that's okay. That's on them, and I think it's okay to form your own decision and
go find a
say,
different
actually, no, I
provider.
really want testing.
Yeah. If you have someone that shames you or is resisting in your request to tend to your body, then go find someone else.
I mean, look at all of
Remy Paille, everyone.
Yeah, Remy. Like, if you're in Santa Cruz, she's gonna have a waiting list now.
Coming in
out the door.
Pianicuff.
Coming in Pianicuff.
Commission from this, but you already probably slammed. You're already like, damn, these are long days.
I know. I like STIs, yeast infections, UTIs. It's like I won't say it's like the easiest thing I do. People are really, human beings are complex, and health is so complex. And so I love doing female, male sexual health because it's pretty straightforward. And I like to help people feel really comfortable to take care of themselves.
I just thought of one that we can do real quick that so many people are frustrated. BV. Bacterial vaginosis. Can be sexually transmitted and also cannot. Can you explain a little bit about that to folks?
Yeah. So our vaginal canal, we want it full of a lot of healthy lactobacillus. And sometimes things can just tip that off. It could be a tip that could tip that off, tip the pH off. Clearly. And it could be somebody's semen that we have a little bit of a reaction to. And then we have other bacteria that live in our vaginal canal. The one that causes vaginosis, BV, is called Gardnerella. And sometimes then the Gardnerella, the pH gets off. And so then all the Gardnerella bugs can have little bug babies, and then they can grow and proliferate.
Oh, it's so cute. Babies.
Little bug babies. It all starts with one bug, which is why it's not going to show up on a test until all the bugs have had babies, and there's little colonization.
It's a whole party in there.
Colonies. Yes. And so then people present with itchy, something smells funny down there. I've got some yellow watery discharge. I don't know what it is, and so I do a swab. I have a great swab that I use from Quest Labs that tests the amount of lactobacillus that you have. So that's really good. So I can help people's vaginas get back in balance. And it tests for a variety of different yeasts and Gardnerella. It tests for trichomonas, which is another STI. And then we treat it. So with BV, My new favorite way, well, it's been around for a long time, but I really like prescribing people boric acid suppositories.
Yes.
I can get them at Loudon, and it will take care of candida too. And it's not totally disrupting all the flora. I don't have to give people oral antibiotics to wipe out their whole gut flora. And it works really well. So a lot of times I just say, I'm going to prescribe this today. We don't have the results. Things you can go ahead and use it. Or if the results are negative, you've just got it in your medicine cabinet and you can use it. And it's really safe. And it creates a really acidic environment in the vaginal canal. And then you can have lots of healthy lactobacillus babies. And that's what we want.
And you can't have
and that
sex
keeps
when you use
everything
it.
ripe and juicy. And
Yeah.
You can't have sex when you're using boric acid.
Right? Because I'm on it right now, and I was looking at I have like my partner's pH and I are just not aligned.
It happens too.
It's such a bummer. And it's like, it bums me out. So we were doing like an alkaline apple cider vinegar shot together every morning, and it was helping. And then when we stopped, now it's back. And anytime there's semen in my vaginal canal, same thing. BV again and again. And I'm like so fucking over it. So I've been on, this is now the second bottle of boric acid that I'm on. Again, sorry, I turned it into me. I'm sorry, listeners.
No, but you're good. That just gives people something to relate to. They're like, oh, that happened to me too.
Yeah.
So that's really common. And how do I speak to that? How do we get you and your partner's flora to match up? It's so complex because there's so many different flora and what's in his sperm that is,
triggering my vaginal flora.
It's
whether
a
that's
tango.
something
It's not just your flora.
genetic or whether that's
is it genetic? I know.
Do you two live together?
We do. And
okay, so a lot of times people who live together, then they start to get the same sort of flora. They're brushing their teeth. They're using the same toilet,
all of that stuff.
And so
I honestly think,
how long does that take? Likely years.
Okay.
Yeah.
Okay. So I'll keep trying.
I don't know.
And maybe it's we eat almost the same foods too. I mean, our refrigerator is the same. We're together often. It's a bizarre thing. And actually the funny thing is my BV starts to smell, I feel like sort of like his semen sometimes. Like I can smell it where.
Oh my God, you guys have just totally acclimated to each other and you're the same person now.
But I know it's
but you
BV.
still get a reaction.
You still get a
time. Yeah.
So it could
frustrating.
take years, so give it some more time. Okay.
Yeah, I'm really not sure what the answer would be to tell you. I would say that there's more research needed in that area.
Okay.
And I don't know also if you're having some sort of allergic reaction. So it's not even a matter of the bugs, but it's a matter of your body has some sort of, just like some people can use a lotion and get an allergic reaction to it. And some people do have an allergy to their partner's semen, and that's not completely uncommon. Yeah.
Well, at least it's
and
not
so it's more of like
blood
a
hemorrhaging. At least I'm not hemorrhaging. That's a plus.
Yeah.
I just stank.
A lot of the women I know that the first time they got BV, they kind of knew something was up, but they didn't understand what it was. And they were in their mid-20s, and they're like, what the hell is this? And they had it for a long time before they finally discovered what it was.
Didn't you were saying that
I'm
happened with one person that you hooked up with? He never called me again. I'm pretty sure it's because I had BV.
Yeah, somebody's partner might be like, hey, honey, what's going on down there?
But especially when it's like a new partner, they've only slept like once or twice, and then they stop calling, and then you figure it out later, and you're like, oh, I had BV, and that's makes perfect sense why we went on 1 or 2 dates and you stopped calling. Okay, anyways, HPV. Let's move on to that one.
Okay.
Human papilloma
Virus?
Yes. So warts are in the same category.
That is the one strain of that virus causes genital warts.
Okay.
Yes.
And
there's many different strains.
Many
about
strains.
40 or
There's
so.
high risk. There's low risk. As far as I know, we can talk more about this. And you actually told me, and we can talk about this too. One is that it's kind of like if you're a sexually active person, just know that the likelihood of you having it or having it like dormant in your body is pretty high.
Absolutely. 80% of us are going to get it in our lives. And so women, we test because there is a really strong association to cervical cancer. And so that's why we want to know if somebody has the high risk type, and we want to keep an eye on her cervix and make sure those little HPV bugs aren't causing lesions to grow on the cervix that could cause problems further down the line. There's no test for men, which is really unfortunate. They just haven't really found a good one. And so as a result, that's just how we keep tabs on it.
and they're carriers, but they don't have symptoms unless they have the warts. Because I've had partners that have had the warts. I didn't actually get that HPV virus from them, but they had the little warts that they had to get burned off. But otherwise, if they have the high risk type that they don't actually have symptoms for, you can't test, and they're just carriers.
No, I mean, we'll do anal paps. And so men can get it in their anus. Yeah. And so we can do anal paps. There is an association to laryngeal cancer. So that's cancer of the throat. And so we can get it in our mouth. And once again, we don't really test for that. That's more specialized, but it's something that if somebody's presenting with cancerous lesions on their larynx, then it would be, like in the realm of possibilities because it is so common.
Mm-hmm. Oh man. And wait, so
the scary world.
Do the warts, do they have to be burned off to be treated?
Yeah.
Or is that's just a treatment and they'll be gone if you get them burned off?
So you can get them burned off. Theoretically, that virus can still be living, hanging around dormant, and it could rear its head again, or it could be gone.
Hence the nature of a virus. That's what they do. They go sleeping for
adaptable
a while.
creatures.
And my question for you, April, since not my question, but because I have a virus. I have the cold sore virus that I got when I was 18 from, thank you, human out there.
HPV-1. HSV-1.
HSV-1. And then I also, before I got that, I had kind of some yeast infection stuff. So those aren't related because the yeast infections actually came first. But BV when I was in my mid-20s, and they started getting these cysts on my Bartholin's gland. And I went to a naturopathic doctor, and their whole thing is like, let's tie them all together and see what the root cause is, and that they all might be related, and this was just a theory, but what they did, her theory was, all right, you have this virus. Viruses are really hard on the body. Like the body is and also if your immune system is already low, and then there's this virus, lowers your immune system even more, and your immune system has to work really hard. And so it makes it more likely, this is just a theory this is a very holistic approach, right? Mm-hmm. You already have a thing that's hard for your body. It makes you more likely to have these other things. So for her, she was like, here's the theory I'm going to go with. Can't say if it's fully true, but you have this virus hard on your body, your immune system gets low, then you get BV because there's this other thing that's hard for your body to deal with already, and now you have this other thing that might be related to that. I can't tell you if it is. She didn't know a lot about Bartholin's gland cysts, but what she did with me is she had me turbocharge my immune system. So I was taking, getting B12, vitamin B12 shots.
Bunch of lysine, right? You're like snorting lysine.
I was snorting lysine. Yes. Like
powdered lysine.
Massive rails of lysine.
I remember you had like
lysine. Yeah,
okay.
No, actually I wasn't even taking lysine. It was like massive doses of vitamin C, B12, and then
wait, that one time you had like a full Ziploc baggie of lysine.
I know.
She wasn't snorting. No, I was joking, but like you did have,
you're
it
right.
looked like you had
was
illegal, you were courier of illegal drugs on a trip.
That's true. I was eating massive doses of lysine, and what ended up happening over time was BV went away. The cysts shrunk. They got shrunk. They shrank.
They shrank.
Why am I doing this with all these words?
I don't know.
All the grammar humans are like, so anyways, total tangent. And so now I'm dealing with the cysts again though. And so I'm looking at this from this place of like, oh shit, did I just give up on boosting my immune system? Do I need to go back and do that again? And I don't know. This is just an idea, right? As they all are. Like we don't have a lot of research on that of them like being related to maybe your immune system is low, but that was just one thing that
I think that's a really plausible theory because we do have, something that we're finally looking at in Western medicine is just the whole concept of inflammation and inflammation and high stress and its relationship, any kind of stress, and viruses cause physical stress that bring down your immune system. Yeah. And then we have opportunistic infections. And so we have, not enough of the good bugs because we really do like all over me right now. I've got good bugs, bad bugs, neutral bugs. And so sometimes it's like the bad bugs can take over and then other viruses can take over. Mm-hmm. And so we're seeing that playing out a lot. Yeah. And so it comes down again to taking really good care of your body and then saying, okay, well, this was working. And so with that, liver health plays a really big role in that, you know, and
everything liver.
Yeah. And so just metabolism of everything we're subjected to in the air and the water and all the creams and everything we're putting in and on our bodies, you know, and then our physical stress and then
our mental state, positivity, and you know, if a lot of negative self-talk versus positive self-talk. Again, there's that holistic piece, is that it's not just like
it's all multifactorial.
Yeah, all of it's playing a part in it, and to look at all of it, and hence why you should go see a nurse practitioner.
Well, how do you feel about answering a question from our listener?
Yeah, let's do it. Let's see how
a listener.
This is a couple questions. Do you want to go to the first one?
We have a few. So I'll read the first one. Amy I'll give her a break from reading. She always gets to read the questions, and
I always mess them up too. I'm
no, you do great. You're the best, Amy. So, okay. I won't do it in any specific accent because I think it's just American right now.
Well, Irish.
I could do a Minnesotan.
Minnesotan. That's easy for you.
I'm specifically interested about knowingly having sex with someone who has an STD, or tips for someone with STDs on how to talk to prospective partners about it. I've had sex with partners who have had STDs, and the pre-sex conversation about it is never easy.
Yep.
Suggestions.
That's never easy.
Yeah. It's that. I mean, that's the key.
Unless you're in the world of sex educators, or and that, this conversation I was saying I had with this other person was very easy because we're both experienced in it, sex educator world. But for most folks, it's not an easy one. So I think just embrace the fact that it's going to be awkward, first of all. But
I liked what you said earlier too. If someone says that they won't sleep with you or hook up with you or have any intimate experiences with you because you have an STD, you've been open about that, fuck that person, move on with your life. You're probably better off. There's 7.6 billion people on the planet now. You can find another human that's going to suit your needs just fine.
Someone else is going to want to. And then again, there's deeper questions that you ask. It's not just like, oh, you have STD, I'm out. Actually, because then you're actually not knowledgeable about STDs either. If you're just saying, oh, you have, herpes, I'm not going to have sex with you. You actually don't know a lot about how herpes works. So you're actually someone that could be more educated too.
Right.
But you can ask them more questions about how educated are they. If I found out, again, someone wasn't educated on it, I'd be like, yeah, I don't think I really want to have unprotected sex.
Let me tell you something. I have a PowerPoint presentation and a laser pointer right here. Here's about herpes, okay?
So it's part of the reason why I would recommend your podcast to some of my patients, because you ladies start the conversation, you talk about it, and then we say, hey, let's talk about this, have a conversation about it, and then come back to informed consent. And so the more informed you are, to be like, hey, baby, let's get informed. And then you can make a decision, and you don't want to do anything with your body that doesn't feel comfortable, and you can put stuff off and you can wait, and there's a lot of juicy stuff to anticipation. Let's get tested together. Let's make this romantic, and then let's get crazy. Something to think about.
Or here's some ways that we can we can reduce risks. There's various ways that you can do that in a harm reduction approach of different. It's not all or nothing, and there's all these conversations.
Yeah. And so the more informed you are about what you can use for harm reduction, because there's so many things out there that you probably have widely available at your store. Yeah,
condoms, dental gloves, finger cups.
Yeah,
these are all options. And then I guess again, outing the discomfort of it, I think don't choose to not have the conversation because it's uncomfortable, right? Choose to have the conversation knowing it's going to be weird and uncomfortable, and out that. This is not a fun conversation to have, but I need to have this, otherwise I'm not going to be able to sleep at night.
And oftentimes it's just the thought of having the conversation that's uncomfortable. Yeah. And then you're like, okay, here I go. I'm saying it. And then you're having the conversation and you're like, oh, we're talking about this. Wow, this actually feels really good. We could do this.
So if you have HPV, we don't should people, but since we've heard from a professional opinion and from a lot of folks in research has said that most folks have it 80%. Should you tell someone that? Is that an important piece, or should it just be known that you're at risk no matter who you're fucking?
Yeah.
Unless you're a ripe, old 14-year-old, whatever, however old people are now having sex.
A ripe old 14.
So the first time I heard that it was okay not to disclose your HPV status was I was just recently at a Whole Logic presentation. So Whole Logic is the company that creates the Pap smear test, that test for HPV. And so we had this nice fancy dinner presentation, and they said, and now you can tell your partners that if they get, you can tell your female patients if they get HPV, we don't even tell them to disclose it to their partners, because usually it's their partners that gave it to them.
Yeah.
It is something that's practically in the water. It's kind of like having a cold in your genitals that you're probably going to clear. It might hang out for a few years, and if it does, we just keep testing it. And so that is the consensus. So I heard that at the Whole Logic training, and then I had to confirm that with one of our beloved gynecologists here in the community, Dr. Jackson. And she said, I'm so glad they're starting to tell people that, because we just don't know enough about it. And that feels like a really safe way. Instead of saying we know everything that there is to know about this, we really don't. We're learning more all the time. And so it is safe to just keep getting tested. So if you present and you're told you're HPV positive after your Pap smear, what that means for you is that you go get tested the following year. And then if the following year you are HPV positive again, then I send you to a gynecologist who looks at your cervix underneath a microscope, and they are looking for any cells that possibly HPV may have contributed to causing some weird, unusual cellular activity. They might take a little sample, send it to a lab, and further look at it. And that's about it. If they see something else, then they might try to use cryotherapy, which is liquid nitrogen, to freeze stuff off.
Like up
and
the
so
cervix or the vaginal walls.
Yeah. So it's a really pretty straightforward process, and it's one of those things that prevention's worked a lot.
Well, let me tell you, I started dating someone when I was 18. I'm 30 for everyone, so I'm still not with them. I was 18, started dating someone. We were monogamous. When I was 21, I found out I had HPV. I instantly went to like, what have you been doing? And they've been like, we're the most committed partner ever. And it's just like thought it was a death sentence, and then learned about it, worked through it, and then got tested regularly, and it eventually went dormant in my body. When it went dormant in my body, I never brought it up to new partners until like later on when we already had unprotected sex. And I've had one partner get mad at me for that, but I was like, okay, I totally get it. Would you still have had sex with me though? Like, would that have changed anything? It's like, no, I still would have, but I just wanted to know. So I understand that there's that part of like, you know, the extreme version of, yes, you can tell them everything about it. Yeah, here I have HPV. It's been dormant in my body for years. You're still going to fuck me. Like, I know this. So I can take that route, and I can say that for most circumstances, especially as a vulva owner having sex with a penis owner, it's not going to change much. And there's not much that they can do about it unless they decide, but it's not going to affect them anyways, right? Like, what penis owner is going to say, you know what? No, I'm really into you, but I'm not going to have sex with you, even though you have dormant HPV, and I'll only be a carrier, and I actually won't have any effects, but I still won't have unprotected sex with you. I mean, maybe someone will do that, but not a lot of them. So I think it is a little tricky that, like, you know, some people could still feel left in the dark, and most of them are still going to bang you.
This is true. This is so true.
And that's
I think you bring up a really good point.
Everyone else has been like, oh, cool, you have HPV.
About, being fully informed and being truthful with your partners.
You mean you can,
but then you hope that people
understand.
So the more you understand about it, the more you can disclose that.
Yeah, that one didn't change much of anything. All right, we're going to go to another sex question. Okay. I've been feeling like this is kind of a similar note. I've been feeling like the pleasure of non-monogamous sex isn't worth the anxiety of getting an STI or STD. I feel like I'm not just trusting the guy I'm with, but others he's been with recently. So this, I think, is a single or the non-monogamous person. Casual sex. Should I be scheduling every sexual encounter ahead of time and have us both go get tested beforehand? So this is like, how crazy should people be about this in terms of this is just like, I'm afraid, I don't trust. Is this a death sentence? How easy is it for it to get STIs, STDs? I'm speaking to a trust issue though. Like the partner could say, yeah, I mean, if you're having unprotected sex with someone, and I'll have you answer this too. If I'm having unprotected sex with April, and April's like, I got tested, I'm all good, but I'm having unprotected sex with other folks, and I had sex with them yesterday. Yeah, you can't vouch for that person's status, right? So I think this speaks more to like agreements. If you're doing non-monogamous stuff, agreements within the whole non-monogamy dynamic.
And you're always taking on any sort of risk whenever you're sexually active with anyone. I mean, you're taking on any risk because they could be a carrier, and they could be a carrier and they could have sex with 15 people that would never have been at having any symptoms. And I don't know the correct terminology, but they would never be, they would never even know they had anything. And then one of those 15 people could have a sign of whatever STI it is. And then they know that now that they're a carrier and that they've been having that STI, and now perhaps all of those people. There's a certain though kind of perfect storm though with every STI, right? There's like an incubation period. There's all sorts of different things that take place into making it the perfect thing. So even if someone does know that they have an STI, they may not get it. But no matter what, I think that you probably have so many good things to say. But
this is why I want you all in my office getting tested all the time.
All the time. The more
no, it's very personal for each person on their comfort level. So then you have to ask yourself, all right, so now that this person's been truly honest with me, then what happens if I get an STI? You have to ask yourself those questions. What happens if I have unprotected sex and I get pregnant? Kind of have a plan so you can kind of calm your anxiety like that. So you can say, what if? Okay, then what? Okay, then what? Then I'll go get treated. Okay, then what? Then I'll have to call everybody else I've slept with and tell them. Okay, then what? Well, then they'll have to call everybody else. Okay, then we're all going to get tested. Okay, then we're all going to get treated. Okay. So I think it's good sometimes to follow that whole pathway down to its very end and then make your decision from there. And I think that that's part of I was about to say fun, but non-monogamy and polyamory is a bit more complex, and it requires people to have and to hone their great communication skills. Yes. And they learn so much about themselves, and they learn how to communicate. And then as a result, they often feel more comfortable in their bodies, more comfortable talking with other people, and have more trusting relationships. And so it could be a good vehicle to start from. Yeah.
Yeah. I think I like that part of just the more you add, whether you're a single person, a non-monogamous person, I mean, the more bodies you add to sharing fluids. And then there's the idea, which we haven't talked about, but the being fluid bonded with someone so that you understand that you are making an agreement to share body fluids based on either we know your testing status and we're making an agreement on that, or we are still just making an agreement not knowing testing status, but that we are committing to sharing fluids consensually and knowing that that's okay. That the more bodies you add, the more complicated it can be, right? The more...
That's true. Yeah. And there is a responsibility that if you show up with an STI, then I say, go call your partners and tell them to come on in here.
Please share.
You know? Yeah. Go have them call their partners, you know, and a lot of people are really responsive to that, and they feel better. It brings people together. They have that conversation, then they get through it, and then they're still together.
I just dreaded STI call.
I know. It's been 5 years.
How do you do? Just want to let you know.
I had one. So you know, I got chlamydia from JTT, just the tip. Well, I had
not Justin Timberlake.
Justin Timberlake gave me chlamydia from JTT, and then I also did JTT with someone else. Apparently, I was on a JTT roll, and it was like just the grazing of the head of the penis. But I got chlamydia from JTT with one person, and so I had to call this other guy that I JTT'd as well. It was like significantly younger than me. It was pretty awkward. They handled it well, and they I was like, so just so you know, I got chlamydia, and I got it from a similar experience that I had with you. And so you should know. And they asked, they were like, okay, what should I do? Like, how do I get tested? Where should I go? And so last time I talked to them, like, they just like never called me back, which is fine. But it was, I mean, again, not a comfortable thing. It's like picking up the phone. Fuck, I have to have this conversation. You know, they may never want to talk to me again. They might be angry. It's going to be awkward. And at least they were able to go and tend to this part so that they didn't pass it on you. So it's not just this chain reaction of this thing. You know, that was my, what I owed to humanity to.
Absolutely. You're protecting a lot of other people out there.
Yeah.
And then they can him and haw over it. They can get angry, and then ultimately they'll be really grateful.
Yeah.
And they'll say, wow, that was really nice that she called and she wanted to protect me. Okay, then I'm going to hopefully pass that forward. That's what we hope. Right. And
there's a lot of humans out there that I've had intimate circumstances with that I've had. I'm talking about like the guy that I had BV with who probably didn't call me back, and the guy that I may have gotten chlamydia to. This one I can sum up really quickly.
Yeah. So, I think that's a better one for you too, because you're.
Yeah. I'm going to sum this one up really quickly because it's a nice long question, but just quickly now before we end, because we've had a lot to say, these are just some birth control questions. This person had an IUD inserted. They gained 40 pounds. They're not saying if it's hormonal or non-hormonal, but they do ask about non-hormonal birth control at the end. So I'm assuming it's the Mirena hormonal IUD. They gained 40 pounds. It's been an issue in their relationship, meaning they're very self-conscious. They think that their partner, their husband actually might not be comfortable with it. Their husband actually wants them to get it removed. Do you guys know any ways to help them lose weight on birth control, or maybe just a way to feel more confident? Well, I have this weight. Are there any non-hormonal birth control pill or birth control options that work well aside from the IUD?
What about a vasectomy?
How do we have something for?
I'm with the penis owning vasectomy.
Me too. It's so nice.
And it's the best thing ever. And if they're not, if children are an option, that would be my suggestion as a non-doctor, but I've been like, do get a vasectomy if you know that you don't want to have any more kids. Mm-hmm. I did think, and this is me being a very vulnerable, dumb human telling you this right now, Remy, I did think a puff of smoke came out when people had vasectomy and they came until my partner was like, stuff comes out of there. Yeah. It's so cool. And the orgasms are just as good, just as amazing. And nothing bad has come out of his vasectomy. And he's like, no, my sex has been just as good, if not better. Mm-hmm. So FYI, but
yeah, so people do really well. I thank men when they come in and they say, you know, we just had 2 kids and now I want a vasectomy. I'm like, it's going to be so easy. I will buy you that pack of frozen peas that you'll be putting on your balls for a little bit, and your wife's going to be really happy. So, so that is a great option.
There's non-hormonal.
Usually, most docs aren't going to want to do it until after age 35. They're going to want to make sure somebody has kids because people change their minds all the time. And then in terms of non-hormonal options, so in my contraception class at UCSF, one of the first things we're taught about is FAM, which is fertility awareness method, which can be a bit complex and allows you to really tune into and know your body really well. And that's around, I want to say like 92% effective. And so use correctly. And it means that you have to know your body. And it also means that you are assuming some risk. And even if you're taking hormonal contraception, you're still assuming some risk because you can still, believe it or not, have an IUD and get pregnant. You can still be on the pill and get pregnant. And with the fertility awareness method, you can still get pregnant. But it is a realistic option, provided you're willing to put in the time and energy to get to know your body and take care of it. So I'm a big fan of that. Speaking to large weight gain and the Mirena IUD, or if you're talking about a hormonal IUD, I wouldn't say that there's as much of the negative effects of hormonal birth control associated with the Mirena because it has a more localized effect than systemic hormonal birth control, like pills, like an implant. And so it's one of the options with the least amount of side effects. If it is a copper IUD, that exerts part of the mechanism of action is that it exerts an inflammatory reaction onto your uterus, and that theoretically could contribute to some of your weight gain in terms of how to lose weight. We want to go back to the basics of knowing your body, making sure you're getting enough sleep, enough rest. You know, sometimes if you've slept 4 hours, that means skipping that workout and letting your body catch up on sleep, which can be more important and more beneficial than pushing through the next thing. It doesn't mean starving yourself. It means giving your body enough food to nourish itself. And there's a whole other litany of things we could go into for weight loss, but those are some of the things that I would impress upon people.
Yeah. We've done podcasts before about the fertility awareness method.
Yeah.
And we actually, the episode's not out yet, but Dr. Jolene Brighton, she was amazing. She was also such just an amazing advocate for other options outside of hormonal birth control. So that can be a real...
Lose the whole podcast, the Fertility Friday podcast, if you want to learn more about the fertility awareness method.
Yeah. Lisa Hendrickson.
Yeah.
She's a really been an advocate in using the fertility awareness method, both to get pregnant and to not get pregnant since 1999. Since so there are ways. And now
I have to add a little caveat. So not everybody is a good candidate for the fertility awareness method. So that would be people with PCOS, which is really pretty darn common. I think it's about 1 in every 10 women. And it's also it's polycystic ovarian disease.
I don't know.
And that's where women do not ovulate, and it's associated with people often have really irregular or no periods. It's associated with altered glucose metabolism. People get hirsutism, which is hair on their chest, on their face, on their neck. And so those people are usually not candidates for
But if you don't ovulate, why would you do fertility awareness method?
Because you really want to know your ovulatory cycles. And so so if you're not ovulating, then you're not able to. And people who have PCOS have a really hard time getting pregnant, but it still is in the realm of possibility.
Okay, it could still happen.
Yeah.
And then also with hormonal birth control, like everyone is different in how they respond to it. I think our last question is related to dosage of birth control too. You figure out if you are going to be on hormonal birth control, you figure out the one that works for you, right? For this person, whatever they're on obviously doesn't work for them.
So many patients who do great on hormonal birth control, and they're like, "Don't ever take that away from me." You know, I have a patients who get the Nexplanon, the implant. They love not getting their periods, and they feel good. When people are coming to me asking for choices, I wouldn't recommend those heavy progesterone hormonal birth control options like the hormonal implant Nexplanon or like the Depo shot, because it can sometimes exacerbate symptoms of depression and anxiety, sometimes cause skin issues. And so it's really personal. And then other people are like, this is the best thing. I come in every 3 months. I get my Depo shot. I've got my Nexplanon. I don't have to think about anything. My skin cleared up. And so
when you use those, the birth controls, this is just a question that I just thought of. So you know how every human has only a certain amount of eggs to shed, right? Yeah. I could have 20 or 200 or however many it is. Do they store those, or are they still shed?
They are still shed. So even if you're not ovulating, you still only have a certain amount of eggs. So it's not like you can preserve your fertility. So that was like a hope. And I think some people were sold that you would preserve your fertility in the amount of eggs. But realistically, no.
95 popping out babies. Yeah, here I go. I was on that Nexo Glycemic law until I was 70.
And now my babies have like 5 eggs. They're super babies.
Yeah. So conventional thought has been you're born with a certain number of eggs, and then you release your eggs every month, and then you kind of use up all your eggs by the time you hit menopause, and that's basically what menopause means.
No more eggs.
I just read an article recently that there's actually stem cells, so there's thought to be, well, maybe we don't use up all of our eggs, and so I feel like there's going to be more newly emerging research. So that's another.
I believe that.
I donated a bunch of my eggs when I was 28, so I lost, I don't know, a couple thousand.
So you have some little baby Aprils around somewhere.
No, none of them ever took. I never. Okay. Yeah, okay. I found out later. None of them ever took.
Okay.
I have another friend who donated eggs, and she's got all
some
kinds of multi-sets of twins out there.
That's exciting.
I know that friend.
Okay, last questions. I'll sum this one up too, since I already read this. My doctor switched my birth control, same brand, just higher hormones. And I stopped having orgasms from the birth control, or so it seems. Switched back to the old one, and I still am having a hard time having orgasms. Do you have any advice? Can birth control affect orgasms? How do I overcome this roadblock? I have never heard of this happening.
Well, can I attest to that? I know that Remy will have some doctoral knowledge. I was on birth control for so many years when I didn't have a partner with a vasectomy. And I have to say, and now I'm sure that I'm going to date myself because there's so many different ones, but I was on several, like orthotricycline, Yasmin, then I was in the NuvaRing, and then I did the
non-hormonal IUD.
Non-hormonal IUD, the copper IUD, and then I had a couple of other options as well, which I can't recall at the moment. And from birth control to birth control, I can tell you, on the NuvaRing, never had one orgasm.
Oh, really?
Yes. On Yaz, I was able to have a lot of orgasms. On orthotricycline, skin broke out, couldn't remember having an orgasm.
Oh my God, I was a crazy person on orthotricycline. I thought I was going to try to kill everyone around.
There was another one in there, I can't remember the name of it. Mm-hmm. And every one was so different. And I don't know, you, Remy, I'm sure will have more. It could have been because of my age variation too, because I was in my early 20s, my teens at one point, and then in my 30s. So I'm sure there's variables in all of that, in all of the applications of birth control. But I can't imagine the amount of hormones not being an imperative effect on what happens with your orgasms.
I mean, I've heard of it affecting libido and desire, but actual like physiological orgasm. But I mean, it makes sense. I mean, it totally makes sense. And here, I think
and I would say that the most plausible, and this is just off the cuff explanation for this, is that hormonal birth control, which is generally combined oral contraceptives, a little bit of estrogen and synthetic progesterone, suppresses your body's natural progesterone. And so progesterone is like this really lovely hormone that females make that helps to stimulate our GABA response. So that's like our really relaxed, feel good response. And so then you just have this phony steroid progesterone-like hormone that's suppressing your body's own natural kind of feel-good hormone. And so the relationship to that and orgasms makes sense to me. That's just a theory. Is that we're suppressing our body's own natural.
Is the synthetic version progestin? Is that right?
Progestin. That's one of them. Yeah.
Right. Dr.
Levonorgestrel.
Right.
Yeah. So
okay.
There's all these different formulations, and each one of them is associated with different side effects, and some people feel those side effects, and some people are like, this is the best thing I've ever had, and my skin is great, my sex is great because I don't have to worry about getting pregnant, so I'm having great sex now. So,
and some do really cause a lot of weight gain, water retention, longer, and some cause you to totally be like looking like you're on the Jenny Crank diet. Like you don't need food. You're like, wee.
Jenny Crank. I have never heard that.
And it's really great to make that connection, because some people will come in and they'll be like, I'm bloated and I'm fatigued and da 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 da. And we'll kind of like let's look at everything you're putting in on your body, and let's like put this whole picture together. And they're like, don't touch my OCPs. I've been on them, oral contraceptives. I've been on those for 15 years. They've always been fine for me. Yeah. Okay. Then I kind of have to be like, everybody's on their own journey. Yeah. But I can just, tell people what they could try. And it's also hard because there's not a lot of great options for women. So
I was like that forever.
Yeah.
I was like, don't touch.
Amy this works for me
to get the IUD, and
non-hormonal.
She had been on it for a few years, and she's like, Chip, just do it. It's no hormones. It'll be better for you. Because I was moving to Israel, and I wasn't sure if I didn't have health care, so I wasn't sure if I could get contraception over there.
Contraceptives.
Mm-hmm. Contraceptives.
Same.
planning ahead. Yeah.
Okay, I'm saying
You got it.
Okay, good. Thank you. Got some margins wine in me. Yeah, it's good wine. It's a good wine. Yeah. So
Margeswine.com, everyone.
I know.
Sign up for her newsletter.
Sign up for her newsletter. However, I have to say that
You hated it. Not the wine. You hated the IUD.
I hated the IUD, and I was telling you before we started recording, Remy, that it made me feel like I was birthing an alien devil child every month because my stomach would be like, and then I'd be like, I can't move.
Yeah.
And then I would have to basically have a heating pad on and I'd never had cramps before, and I gained a bunch of weight, and it was awful. And when it was removed from me uterus, I felt like a fucking reborn human. I was like, this is the best day of my life. And I felt literally like the best thing ever.
And then she's like, fuck you, Amy.
Yeah.
And you're not the only one, because there's multiple people that I recommended that
I didn't blame you. I just thought you were just such a boss for like being able to
tolerate it. I have a high pain tolerance.
Everybody's
and I'm also a little
so
bit of a
different.
masochist, so I should have warned people.
I have a high pain tolerance. I broke my arm, didn't even in 2 places, and didn't even really flinch.
I like me some fucked up shits. I'm sorry.
And as somebody who puts these in women a couple times a month, okay,
My uterus
I
hurts.
counsel them where I'm like, you are not stuck with this.
Yeah.
Some people love it.
Yeah.
Some people, they're like, I want that monthly period. This helps me feel normal. I generally will recommend Paragard Copper IUD for people who have light, really easy periods already.
Yeah.
If somebody has cramps, I'm like, oh, probably not the best one for you.
Oh, yeah.
And people love it. Sometimes people can have copper zinc imbalances, and so their body just gets copper overloaded. I recommend copper
happened to me.
for anybody on hormonal birth control, or actually anybody who walks in my door. I want to give everybody magnesium. So I just am like, take magnesium and B vitamins for almost like whatever ails you. Take these things every day. Especially with hormonal, especially with hormonal
as a woman,
birth control.
Remy, what kind of birth control do you use? You don't have to share if you don't want to. But what would you?
She has a vasectomy partner.
But I've had a couple of Mirenas that I love.
Okay,
yeah. So before that, I'd been through the gamut. I think I started on oral, I just call them OCPs, birth control pills, when I was a teenager. My mom was like, you're getting these. I'm not getting a pregnant daughter. And it was great. But then I remember screaming at my mom. She's like, it's not you, it's the pills. You know? And so,
you want an excuse? Get on the pill.
yeah, exactly. You know, and so now I look back and I'm like, wow, I had a lot of emotional ability. And so now I'm like, was that the birth control pills? And now, you know, part of my job is I do a fair amount of psychiatry and mental wellness checks for people, and sometimes distinguishing, is this you? Is this teenage angst, or is this other hormonal influences? And so I use those. I use the NuvaRing, you know, and each one uses a slightly different form of progesterone, and it's mostly all estradiol. There's a couple different formulations in there. And then I got the Mirena IUD actually when we had the Governator, Arnold Schwarzenegger, and they were making all those cuts, and I was like, I better get something to cover me for 5 years before I can't get my birth control. And that's when I got it. And they remember it hurting really bad to get in. I remember feeling really, really crampy, and then going over to a friend's house afterwards, and she was like, well, you should try labor. I was like, okay, I'll shut up.
Yeah, I'll stick with this.
You know? And then I've had a couple of them, a couple Mirena IUDs, and they worked really well for me. And then that was my commitment to my partner, was getting my IUD out in March. It was just due to come out, and I was just going to get another one in. But I got it out, and it was really easy to get out. And and he's had a vasectomy, and my periods have come back, and they're 2 or 3 days, easy peasy. I take a lot of magnesium. I try to take care of myself, and it hasn't been an issue. My partner keeps asking, like, do you notice anything different? You're liberated, you know, and I did call it liberating my pelvis.
I love your feminist partner.
And
I don't even know your partner, but I love
yeah,
him.
you would love him.
Yes.
Yeah, I love him too.
Is he listening? I love you.
Hi,
I don't know you. What's his name?
Quinn.
Oh, hey, Quinn. We love you.
We love to say his name.
She did.
Yeah, I think we can say his name.
She can do what she wants. We're not responsible.
Okay.
Yeah.
Hey, Quinn.
We love you in your feminist ways.
Yeah, we do.
I want
You're
Remy.
amazing.
I want to hang out with Remy. Maybe I should.
I'm your neighbor.
Well, I don't have insurance right now, but maybe when I get insurance.
Do you want to hang out with Remy just so you...
Medi-Cal is awesome insurance.
Well, no, I
You don't have to go
typically.
to the doctor's office and hang out with Remy.
No, this is true. But I think
You can just
I would
invite me
really-
over to come use the hot tub.
Yeah.
That's true.
Yeah.
I'm like, hey, I have an exam table in my bedroom. Would you mind giving me a quick exam? I'm just kidding.
I've had friends who are like, can you take out my IUD?
I get
Yeah.
weird with stuff.
Yeah.
Obviously, the trauma. And
Absolutely.
The shame.
That's very,
So,
very
yeah.
real. And that's why part of why I love my job is I'm like, I want to make this a safe place to really help you live your best life.
Yeah.
Yeah.
Well, not
It's
for this
hard work.
podcast. You might blow up in Santa Cruz, and now I'm never going to get to see
I
you.
don't know if we're giving people Remy's contact.
Okay, well, sorry, people. If you want Remy's contact,
like most guests in the podcast have like a plug, like, oh, and here's like a workshop I'm offering, or here's how you can work with me. But like,
this is just your.
I don't think you're
Like,
looking for more.
Well,
clinical
I
offers.
will
What you got?
say, okay, so I am building my practice,
Okay.
and I will say I have no shortage of patients
Okay. We got room.
across the spectrum, but that I love doing women's health and helping women on their path. So they can come in and establish care, and then they would see our whole team as needed. So that's what Dignity Health and Mission Street.
Santa Cruz.
In Santa Cruz, yeah.
So it's Remy. How do you spell your last name?
It's Paille.
Yes, also known as Dr. Remy, also known as
Nurse practitioner. And a lot of people say doctor.
Santa Cruz. That's my dubstep impersonation. All right, this was awesome.
much
I
good information.
absolutely loved. I mean, I don't even know. This could be like a 2-hour podcast at this point.
I know. The tangents.
Yeah.
Perfect.
So thank you, Remy.
Yeah, thanks
it's such
for
a
having
pleasure.
me.
It was
Yeah.
amazing. Your dog was awesome. Her dog Dash is here.
Yeah.
It's okay to name
If you heard him
names.
barking,
He told me.
that was April's little dog.
My little dog was barking like a little beast ninja that he is. And I love you, Amy.
I love you too, Chip.
Yeah, you're nice.
I love you ladies. And I recommend your podcast to my patients.
Yay.
You know?
Oh, so your
Yeah.
patients are listening. They're like, oh, my doctor's on here. Hey, Remy's patients.
Hey, Remy's
I'm one of Remy's
patients.
patients too.
If all of you, Remy's patients, or folks that are listening, avid listeners, or maybe new listeners, could just go to iTunes and search for Shameless Sex Podcast. Give us 5 stars. It just helps more folks find our advice, our information, amazing experts like Remy. Quicker, easier, faster. And we love you. We read every single one of your reviews, and we adore our listeners. We send you love every night before we go to bed and when we wake up in the morning too.
Woo-woo.
Sometimes in the middle of the day.
Sometimes in the middle of the day, all the time.
All the time.
All the thanks, all the time. We love you. And thank you, Shameless Sex Revolutionaries. Ciao for now.
Bye.
Don't forget to head on over to our website at shamelesssex.com for more. And for 15% off of some of our favorite sex toys, use coupon code SHAMELESSPP in all caps at purepleasureshop.com.